how to use neurology to highlight food intolerance. I'm Dr. Michael Lee, founder of One Method here, consultant in pain and performance. Thank you so much for checking in on today's channel, whether it's on Facebook, whether it's on Instagram, whether it's on X or even YouTube. Thank you so much for checking in today. And obviously today you're probably either a clinician that you see patients that are really struggling either with chronic pain, but most importantly thinking of why are they still in pain, and it's got to be something else, because you've literally thrown everything at them, including the bathroom sink, and you're probably thinking, how come nothing's actually changing? So how many of you are clinicians here, whether you're physio, osteopath, doctor, chiropractor, sports therapist, that you're probably thinking, hey, what's actually happening? And why are there certain patients that, from all my training, I'm doing all these things, acupuncture, manipulations, massage, I'm doing all these different things, exercise, but it still isn't clearing, whether it's back pain, neck pain, knee pain, hip pain, shoulder pain, migraines, all these things, because guess what? All of those areas that have become painful can be created by a food intolerance. Yes, you're probably thinking, what do you mean by food intolerance, Michael? How can that be? Because here at the One Method, we have a belief here that your inner health reflects your outer health, right? So whatever happens inside will then determine what happens outside, right? Just to make that clear. So whatever's happening outside in your life, it's just a reflection of what's happening inside of your life. So make sure your inner health is well looked after, because if it isn't, your outer health will suffer. It will show up. That's why people have breakouts. That's why people have diseases. That's why people have headaches, migraines. That's why things start to break down, because they're not looking after their inner health. Because just think about it. When people have chronic pain, these are the people that are always depressed. They're always grumpy. They're always complaining. Why does my symptoms not get better? And they're actually going through this whole cycle through weeks, months, years, if not decades. And they really don't know what to do, because they've done absolutely everything to try and improve their symptoms, but nothing seems to change. Nothing seems to change. And again, all this treatment, think, it's still the same. But they don't look at the areas which you haven't explored. And I always say to people is, yes, if something isn't changing your symptoms, you've got to do something different. Because the definition of insanity from Albert Einstein, he says, insanity is when people do exactly the same thing over and over again, expecting a different result. So if you want a different result, don't do the same thing. Don't be insane. Do something that's different to whatever you're doing now, because whatever you're doing now will always create the same result. Okay, so if you're one of those that always think, I always need a massage, always need manipulation, and I just need it every single week to make sure that it keeps my back pain at bay or my knee pain at bay, I'm like, well, you're treating symptoms, you're not finding the cause. Because you need to be really finding out what's actually causing it. Why do you always need those treatments? Because those are just treating symptoms. Because surely at some point in your life, everything worked perfectly. Everything worked perfectly. You didn't have to worry about things. And some people think, it's because age. Well, if it's age, tell me, what can you do about your age? Exactly, nothing. You can't change your age. The age isn't the reason. As we get older, yes, what happens is things break down. But why do things break down? It's usually because things are overloading. Why are things overloading? Because a lot of things have stopped working. When things don't work, other things have to do the job of things not working, right? And that's what we need to find out, the causes. Why are things changing over time? So you're probably thinking, so what has chronic pain and neurology got to do with food intolerance as well? We treat it a lot, and I want to give you this opportunity to be able to treat it too. Because whenever someone consumes a food intolerance, it is their toxin. It's specific to their DNA. It's something that shuts down their system. It's something that harms them. It's something that hurts them. It's a poison. It's their toxin. That's why people with food intolerances, they get these symptoms: bloating, low energy, lethargy, constipation, diarrhea, reflux, headaches, migraines, joint pain, back pain within a couple of hours of consuming foods. Question is, why does that happen? Well, that's why these are the people who always say to me, I've got no rhyme or reason. I don't know why it happens. It's so random. I said, yeah, because something you're eating. Because I can tell you now, that's something you do every single day. You eat. But the only thing is, you may eat something different. So if you're eating something differently, you might have a different response. But the only time they can really determine if they are consuming the right thing is actually because if they do a food intolerance test and really find out what's going on. But the thing is, once they've got the data, it's either, they stay away from the intolerances, or you can treat it through neurology. Because what tends to happen is this. When someone consumes a major food intolerance, because it's their toxin, the basal ganglia will protect the body, right? And it'll protect it by shutting down the entire system. That's why everything goes weak. That's why people have back pain because of food intolerance, because it's there to metabolize what they're about to consume. Because I always thought, the tongue, the main function of the tongue is for taste. No, it isn't. The main function of the tongue is to tell the brain what's about to enter the system so that it can then prepare to get rid of the toxin. That's its main function. It's protection. A lot of things in our system is about protection. It's not about pleasure, it's about protection. Because at the end of the day, our brain's number one priority is survival, right? To stay alive. And this is why we have all these different compensations, because the brain's compensating to make sure we survive. So you're probably thinking, hey, how would you figure this out, Michael? Well, the thing is, I did a study. It was in 2007? So it's quite a long time ago now. I asked the professor at the time, I want to do a study, chronic lower back pain due to food intolerances. And they thought, why would you want to do that? Which I thought, actually, is a good point. It's a good question. Why would I want to do that? And my response was this. Whenever I see patients with back pain, they always have the same pattern. They always put their back out, very rarely due to a massive trauma, usually due to something ridiculous like tying a shoelace, picking up a piece of paper, twisting in bed, brushing their teeth in front of a sink, then the back goes. And the question is, why has that happened? Because at the end of the day, you have over 100 muscles in your lower back alone. For the back to go and become painful, every single one of them had to switch off at exactly the same time. And I want to figure out, why does that happen? It has to be something that we do every day, like eat. So of course what I id was I got over 200 patients, gave them food intolerance tests, found out what were they most intolerant to, so 100% sensitive to, got the food, put it onto the tongue, because I knew the tongue's function is to protect the brain and protect the body. As soon as that food touched the tongue, there was a reaction, because I put electrodes onto the spine to check the neurological signal from the brain to the spine, and guess what? As soon as the food touched the tongue, the signal to the spine switched off. I'm like, wow, this is really interesting. Just straight away, immediately, didn't have to wait, immediately it changed. I thought, let's start the stopwatch and wait. Let's see how long I had to wait until these nerves started to work. Because remember, if a nerve doesn't work, the muscle won't ever work right. So what I did was wait. Guess how long I waited for? A minimum of 4 hours until the first signal was sent. I'm thinking, if it's 4 hours, if they consume a food intolerance for breakfast, lunch, and dinner, they're stuffed. They're at high risk for a minimum of 12 hours. And that's why people put out their backs. They get joint pains because certain areas of the body just are not working, because the priority from the brain is actually to look after and get rid of the toxin. So this is how we use neurology. This is how we need to detect it first. We need to find the data. But once we've got the data, then we can use neurology to then go and treat it. Because put the food onto the tongue, test the quad, test the deltoid, test whatever muscle you want. It will go weak if it's a major intolerance. That's the natural response. But the question is how do you treat it? Well, treating it is quite straightforward, because every single food intolerance will always have a corresponding organ. As soon as we find out which organ it is, so you can actually just compress the organ, it would then negate the weakness. And then that is the organ we need to treat. Unfortunately, because we're on social media here to tell you about it, I can't really show you it, because not only I need people, but ultimately I need to show you physically to give you the understanding. But I wanted to let you know that actually these are the things that happen every single day. And the great thing is, as soon as we treat these people, when they are exposed to that food intolerance, there's no response. Nothing shuts down. Everything stays strong. All the neurological signals are working, and then their system is robust. Now just think about it. How many patients do you think would like to be more robust, even after eating a food intolerance? How many do you think would like to make sure their back can hold up, even if they're doing the smallest of things that usually put it out, whether it's tying a shoelace, picking up a piece of paper, brushing their teeth? All of them, right? And this is my goal here with the One Method, is how to make sure we know what the triggers are that shut people down, and then make them as robust as possible so it doesn't shut them down again in the future. Then they can live their healthy and happy life. So I really hope that you're actually getting this. And if you are, just put in the chat what you've learned, because once you understand what you've learned, I can help you with that. But if you want to learn more about this, we do have a live course coming up very shortly. Just put me in the chat if you like the details of that, where we'll be looking at neurology in terms of how the brain looks after the body and what causes it to shut down to, and how we can treat it too. So if you're interested in actually learning more about getting incredible results that actually change people's lives, it gets to the root cause, and it doesn't treat symptoms but the cause, to not only get rid of their pain but most importantly, stop it from coming back. So thank you so much for watching today here on the One Method, and I really hope that you have a wonderful rest of your Wednesday. And if you've got questions, let me know, put it in the chat. And if you want to know when the next courses are, if you want any bonuses or special offers, put me in the chat. Happy to help you, and I look forward to seeing you next week for the next live. Have a great week. Bye for now.